Good morning everyone, Kate Perkins here from Cancer Rehabilitation and Lymphatic Solutions and the founder of the Bounce Back from Breast Cancer online exercise rehab program, such a mouthful. Here for another Friday Live. Thank you for joining me, and today on the couch, on the chairs, I have Dr. Kelly Needham and Dr. Jody Ralph. And today we are going to open up the conversation about intimacy and sex and the side effects of cancer diagnosis and cancer treatment and how that impacts a lot on women's lives. And we'll also be talking about the services that these ladies provide at Kelly's new clinic, Coastal Goddess, that has recently opened up at Saratoga. Congratulations.
Thank you.
And so we'll be talking about vaginal rejuvenation techniques and also the O shot.
The O shot.
That Dr. Jody is the only
practitioner on the Central Coast who provides this service. So,
wonderful.
Yeah, so worldwide it's very exciting.
That is exciting. So we'll be delving more into that, and we'll be opening up to questions if you would like to pop them into comments, and even afterwards if you would like to even just message us any questions, we'll be able to have Dr. Kelly and Dr. Jody answer those. So I'm going to start off with some introductions and background. So Dr. Kelly, you have an extensive medical background. We were just talking about this off camera before. Yes. So you started off as a sonographer.
Yes, that's right. So straight out of school into uni, radiography, and then into sonography.
And then that led you into...
So I was a sonographer for 10 years, and then I decided that wasn't quite enough. I wanted a little bit more, and so I went back to uni to do medicine. And that was at the time that I had 4-year-old twins. So it was a big call, but really grateful that I made that decision.
That's, we were just saying before, busy women get things done. Yeah.
You have to be organised.
Yeah. And that's where you met Dr. Jody.
Yes.
First day of med school, we met.
Yeah, so no, it was, and we're best friends since and working together, which is
That is fantastic.
Wonderful.
I love that.
Yeah.
And so you have been working as a doctor in radiation oncology.
Yeah, so I did my internship at Gosford Hospital, and then I worked at the Cancer Centre at Gosford for 3 years as a radiation oncology registrar, which I absolutely loved. Yeah, it's probably one of the favourite times of my 8 years of medicine so far. Yep. So, and then after that I moved into the private sector, doing surgical assisting and medical officer in the private hospitals, 3 private hospitals up here.
And so that's in obstetrics and gynecology?
Obstetrics, gynecology, I do some orthopaedics, some bariatrics, general surgery, so most things. Yeah.
And I just want to point out too, before these ladies came in to join me this morning, they've actually been delivering a baby.
We had a lovely morning this morning. We were really lucky to have a really early C-section this morning. It was the most beautiful, beautiful time. So I was there as the assistant for the gynecologist, and Kelly was there as the house doctor.
Right.
And it was just a beautiful, beautiful time. Nice. We're so lucky to get to do that and be part of really special moments of women's lives.
What a way to start the day.
It was a great way to start the day, actually. It's beautiful.
That is awesome. And so, but before we go over to you, Jody, so what led you into wanting to open up Coastal Goddess?
Look, probably for the last 3 years, doing aesthetic medicine was something that I've been really passionate about, and been doing training and things. That's obviously been hindered by COVID over the last 2 years. But I never wanted to open a clinic that was just doing cosmetic injections and cosmetic treatments. I wanted a more, versatile, multifaceted space, and I wanted it to be particularly for women. Yep. So it was actually about 12 months ago, we were having a conversation about opening a cosmetic clinic, and it's like, what can we put in it? And then, the topic of women's intimate health and sexual function and intimacy came up, and as I said, like it just seemed like they were meant to be together. So that's what Coastal Goddess is offering. So we're offering some aesthetic treatments, some skincare, and women's intimate health, and just a really safe, calm, inviting space for women to come and get treatments and talk about things that are sometimes taboo. Okay. A lot of, even with the cosmetic stuff, a lot of women don't tell anyone I've had it done. And the vaginal intimacy stuff, they're like, oh wow, I didn't even know this existed. Like, what is that? So I feel that we're really touching on a really big space, and there's lots to come in the future.
So we'll delve more into that in a second, because there's a lot to talk about there. Dr. Jody, we have had a connection well before this, because you were referring patients to me to be assessed and treated for lymphedema.
That's right. So I've been working as a GP for about the last 5 years, and I've actually stopped working as a GP now to focus on Coastal Goddess. And still doing surgical assisting like this morning. But I was really lucky to find out about what you offered, because I was working at a very local GP clinic. Lymphedema is another one of those things that a lot of people just don't know about in the general population. You know, we talk about health literacy. I think lymphedema, the health literacy around lymphedema is really, really low. So I remember seeing patients and thinking, that really looks a bit like lymphedema to me. I'm really suspicious. Start talking to the patient, I'm getting this blank look on my face. So I was really lucky to have you just around the corner. You could do a good assessment and provide support services. So
thank you, and thank you for being one of those proactive GPs that didn't just ignore the situation and referred on. So it's wonderful to have that extra education.
I was lucky to get it from
across.
you.
I was out there knocking on doors. And so you worked in London?
Yes.
And Lismore? And Sydney?
Yes.
And was that after you graduated from medicine?
No.
Okay.
So I came to medicine later in life. I think we were just talking about when we started medicine. So Kelly had 4-year-old twins, and I had my 3 children before that as well. My youngest was 1.5. So I've worked in London working in banking and finance.
Oh wow! You had a past life as well.
I did. Yeah. So I was an IT nerd, which I really enjoyed in London, and also here in Sydney, getting to do some really good IT work. And then came back to Australia, had my 3 kids then, and then decided to do medicine after that. So I was, I think, 34, 35 when I started, just a couple of years older than Kelly. And so graduated just before my 40th birthday from medicine, and really lucky to do my internship and residency here at Gosford and Wyong Hospitals. So got to know the area. It's a great place to bring up kids here.
Oh, it's brilliant.
So really, really lucky, and stayed.
Yep, fantastic. I was a mature age student myself when I was studying occupational therapy. So were you?
We have a lot of similarities.
We do have a lot of similarities. It's great. And I think it doesn't matter, you know, you get there eventually. And I think when you're passionate about something, you do something really well.
Absolutely.
I think we were all lucky that we actively made a choice to do the OT of the medicine. It wasn't like something like, oh, I've got a good mark in my HSC, what am I going to go and do? Like, this was actually an active choice that all 3 of us had to really step up to.
Yep, absolutely. So just a note out there for all the HSC students, if you're ever watching or your mums are watching, don't worry if you don't get a good score.
Oh no,
you've got plenty of time.
Yeah, 100%.
My kids are doing their HSC at the moment.
Oh,
so
wow.
Yeah, I think I was about to go and sit an exam now.
Oh, nice. Yeah, it's not so bad if something happens.
There's life after the HSC.
Life, yep. So, bringing it back, I see a lot of women in my clinic every day, diagnosed with breast cancer, undergoing treatment, and also other women who've had cervical cancer and associated treatments, and vulvar cancer and associated treatments. And there are so many side effects from the diagnosis of the cancer, and the surgeries, the radiation, the chemotherapy, and the hormone blockers. And women see themselves differently at that diagnosis and then the treatment. And so they lose that connection with their own bodies, and not wanting even to touch their own bodies, but not feeling sensation. There's vaginal dryness. They lose their confidence, they lose their self-esteem, and that connection, intimate connection with their relationships. So it is a Pandora's box of feelings and emotions and physical feelings that get lost. And it is an area that women are embarrassed to talk about. There's a lot of things that they hold on to, and I'm dead sure that they don't know where to turn or who to ask about these things. So I'm talking about vaginal dryness from the medications or radiation, the chemotherapy, and the difficulty having sex as well because of pain symptoms. So I just really excited to have you on the Friday Live so we can talk about this. You're using the Petite Lady.
Yes, we are.
Can you tell us about that?
Yeah, so the Petite Lady is an erbium laser machine, so it's a fractional laser, but it's much gentler than the traditional CO2 lasers, which have been around. I guess people have probably heard of the Mona Lisa. Okay?
Right.
That is used for vaginal treatment, but it's the Mona Lisa. It's a CO2 laser. It's quite painful, and there's a fair bit of downtime after it.
Right.
Okay, which is why I chose the Petite Lady when we were choosing our machine to buy. It's a much gentler treatment. Okay, you generally need 3 treatments, spaced about 4 weeks apart. And it's similar to a transvaginal ultrasound, which most women have had after they've had a baby. By the time they've had a baby, they've experienced an ultrasound. So it's not an uncomfortable procedure. And it takes about 20 minutes to half an hour. Okay, and that's probably including our conversation and chat. So the actual procedure is only about 15 minutes. And there's essentially no downtime. You could walk straight out of there and go back to work. Okay. The only, precaution is that we say to avoid sex for 48 to 72 hours. So, but it's basically what the laser's doing is, as you would know with your laser machine here, lasers aim to basically create a thermal reaction in the deeper layers underneath the skin and in the tissue. So in this case, in the vaginal mucosa. That thermal injury, then stimulates our cells to increase our growth factors, increase our collagen, increase the blood vessels and elastin to try to basically rejuvenate that tissue. Okay. So that's how it works.
So does that increase the lubrication then?
Yes, so once you get those new cells, that's when you get increased lubrication. So that will obviously help with the vaginal dryness, and that also addresses the pain as well. Okay, and it just gives it the vaginal mucosa that elasticity. And often what happens when you're either shot into menopause from chemotherapy or radiation or hormone treatments, or you go there naturally, even if you haven't had cancer or you're postmenopausal and had cancer, those treatments, they amplify the symptoms that you're going to experience. Okay, so you might have a 35, 40-year-old woman who ordinarily would go through menopause at 50 over a few years and may not experience the same severity of symptoms. Whereas if you go and have chemotherapy, that knocks out your ovaries, you're on hormone treatment for 5 to 10 years, and you're almost instantly into menopause, okay? And the body doesn't cope very well with that, okay? So that's where this option of vaginal laser comes in, because the traditional treatments of vaginal atrophy, estrogen treatment, so whether systemic or topical within the vagina, systemic women with hormone positive cancers, which is 80 to 90% of them, can't have it, and there's still a big debate about whether vaginal estrogen is okay in women with breast cancer.
Yep. Okay.
Because increasing your systemic level of estrogen
It's going to increase
is going
that
to
risk.
increase the risk
Yeah.
of recurrence.
Yep. What if someone has had radiation for cervical cancer, even vulvar cancer? What is the time frame?
So we would generally wait 12 to 18 months for
Yeah.
that area.
Yep.
For post-breast cancer, so if it's been a systemic thing, we generally say to wait 6 months.
Yep.
6 months
Okay.
after all treatment. And obviously with the cervical and vulval treatment, it's more so you are giving that tissue the time to kind of heal
Yeah.
rather than trying to then create some more thermal damage,
Yep.
thermal injury to then create more healing. So and it can be quite painful up until that point in
Yep.
time.
Yep. So what's the time frame between the 3 treatments?
4 weeks.
4 weeks.
Yeah, 4
Yep.
weeks or 4 to 6 weeks, obviously depending on your schedules. But basically what it's doing, it's creating that thermal area, getting some healing, and then basically just trying to get that peak. So
Yep.
just a little bit of time to heal, then let's do it again, and then again.
What if someone has vulvar lymphedema post
Post treatment.
treatment?
Yeah, look, that would be okay. Like,
Yeah.
I don't know that. So your laser would be a much better treatment for that.
Yeah.
Okay. Yeah, we could certainly, if they were still having vaginal issues, we could certainly do the Petite Lady, but the first issue would be addressing the
Yeah.
lymphedema
Yeah, definitely.
with your services.
Yep. And I just think that's amazing how it all interrelates, you know, our treatments as well. So, clitoral stimulation with the O shot. Tell us about what is the O shot for a start, and when and why women would be coming to you to get the O shot.
I love that we're having this conversation, Kate. Could you imagine this conversation happening a few years ago?
Nope.
I can't. There's so much stuff around to help with men's sexual health. You know, so many drugs being developed, and yet with women's sexual desire and performance, there's such little performance being, probably not the right word there, but you know, it's so little information around and so few options for women. So the O shot is another way that helps with sexual enjoyment. The O shot helps with vaginal lubrication and clitoral stimulation. So what is it is the big question. So what we do is we introduce the body's own growth factors back into the clitoris.
Yeah.
So the logistics of this are that we take a blood sample, like if you're going to have a blood test at the pathologist, we take a blood sample. That blood sample is then spun so that the different parts of the blood are separated, and we draw off from that separated urine blood the liquid gold, which is called the platelet-rich plasma. So that platelet-rich plasma is actually golden colour. So it
Wow.
It's
Okay.
actually
Really?
gold.
I had no idea. That's cool.
Yeah. If you've ever given plasma at the Red Cross, or if you've ever seen somebody there, you can actually sort of see the golden colour of the plasma. That plasma has got a lot of great things in it, including growth factors. So the centrifuge spins your own blood, you get the gold, the liquid gold off, and that liquid gold gets reintroduced into you just through 2 little injections. That liquid gold has got growth factors in it that stimulates your body's own clitoral tissue to grow new blood vessels, to grow new tissue, to grow younger and multiply.
Oh wow.
So it's not just physics of putting something else in there to make you have a bigger clitoris. That's not what we're going for. So
it's completely natural.
It's completely natural. It's your body's own liquid gold. It's amazing technology. It's really similar technology. You know when you can get an injection from the orthopedic
So the PRP
surgeon?
injections into your joints.
Into joints and things like that. It's the same technology where your body's own growth factors are helping to heal your body and grow brighter, newer tissue. So if you think about you getting a brighter, better clitoris.
Yeah, that's amazing. That is so good.
It is great. I love it. Where was I going with that? I don't know.
That almost reminds me of the Austin Powers when he opens up the box and it goes, oh, and it's this golden glow.
That's where I was going with that. So it's not an immediate effect on your clitoris and on your sexual function.
Okay.
Over the period of a few weeks to months, the clitoral stimulation effects get better. So
it's just with 2 injections or is it repeated over the couple of months?
You need to get another one about every 18 months, they say.
Oh, wow.
Most
Okay.
people, it lasts at least 18 months. There has been some people say they need to repeat. Oh, sorry, repeat after 12 months. But yeah, so 12 to 18 months, we say 2 years that you repeat this. It doesn't last forever.
Yeah.
But so you come in, the whole session takes about 45 minutes because I chat. So theoretically, I should be doing this in half an hour, but I'm just chatting away. And so you just get an injection next to your clitoris and into your anterior vaginal wall. The next question you're going to have is, does it hurt?
Does it hurt? Is it painful?
Hurt? Yes. Really, really good question. There is one point where we inject some local anaesthetic in next to the clitoris, and that's like a hot, burny sting pain for about 7 or 8 seconds.
Yeah, okay.
So if you can tolerate that, and it's not horrible, I'm not going to tell people no, there's no pain at all, because there is about 7 or 8 seconds at one point where it does feel uncomfortable, but most people can tolerate that. At Coastal Goddess, we have got Entonox, which is the happy gas. You know, when you breathe it in, some people have it during childbirth. So if you're somebody who doesn't cope very well with anything like that, you get a few puffs on the Entonox and
as well as
breathe your way through
topical anaesthetic.
Oh
as
yes,
well.
of course. Yeah, there's topical anaesthetic as well.
For the numbness.
Yeah.
Yeah.
So what's the research behind?
There is lots of research, and some of it we've got referenced onto on our website. And there's also a book as well. So this is not a procedure that we have made up. This is a procedure.
This is evidence-based practice.
Evidence-based practice that has been going for many, many years. And we've got our training and all our information through a group through the United States who've got, all the ducks in a row, and they've got a book, and we've got heaps of copies of this book.
Okay.
I'll leave one copy with you, but if anyone wants another copy, just message in. And
so this is the Activate the Female Orgasm System. So we'll have a copy of this, but we'll be directing everybody over to the Coastal Goddess website and Facebook page, Instagram, and if you want to get your hands on this book, let us know.
Yeah. So that's just for the sort of people that like to know how everything works, and that book references a lot of the research as well. But PRP has been around and used for different purposes for a number of years. We were talking about joints before as well. So this is not new science. This is stuff that different areas of medicine have been using for a number of years. It's now just being started to be used for female sexual health.
That's amazing, and it's the only place on the Central Coast. And so I've been to the clinic at Coastal Goddess, and it is really lovely.
Isn't it beautiful?
Yeah, you've just set it up so beautifully, because you've got a relaxation room there as well, for in between.
Yeah, so if you're having anaesthetic or it's basically, it's quite private. There's a TV, you can have a mimosa if you like. We've got a mimosa bar.
Great. And so you've just also, I saw on your socials just yesterday, Friday afternoon group bookings.
Yes.
With mimosas and
antipesto platter.
And PRP.
So we can do PRP or anti-wrinkle.
Anti-wrinkle.
Yes.
Yeah. I love that idea.
That is a great idea.
Girls are going to
Get your girls together and
you book out the whole place.
So you have exclusive use. So that's why we've
beautiful.
dedicated it to Friday and Saturday afternoons.
It's excellent.
So we've got that beautiful front room, which is just really nice and casual for girls to just get a bit silly in and have a few treatments, go into the private rooms.
That is a great idea.
Yeah, I think it's going to be really fun. It's really safe space as well. It's just nice.
And you're right near the water.
Yeah.
Over at Saratoga.
It's lovely. It's a lovely
spot.
So
can you tell us a little bit more about the other services as well?
Yes, so the other services we offer are, as I mentioned earlier, so your cosmetic injectables, so anti-wrinkle, Botox Dysport, dermal fillers, PRP to the face, also known as the vampire facial, made famous by the Kardashians.
Which is again
Right.
that
So
same
that is
technology.
the same technology, but it's injected into the face, and it's actually my favourite treatment. Jodie and I went down to Melbourne to do our training for that in the very short time period that we're allowed to leave the state.
Yeah.
We got back just in time before lockdown.
Oh wow.
Yeah. So Jodie's done mine, and I did Jodie as well as a few other clients that day. But yeah, I love it. It's fantastic. And then we also have a wonderful dermal therapist who's been in the game for 20 odd years.
Susan?
Samantha. Yeah,
Sorry.
Samantha. And I'm very, very grateful to have her. So she does our laser facial skin resurfacing.
Yes.
Okay, so we can actually use our same machine.
Okay.
Different probe, not going in the same place. And she does medical grade peels. We've got a LED heal light therapy treatment.
Yes.
And other facials.
So you would use the LED light after the peels?
So it's a really good add-on to any treatment. So it reduces bruising by about 80% if used after dermal fillers. So I don't know if people know, but you get a bit of bruising. So if you have your LED it takes 13.5 minutes post-treatment, then your bruising is reduced dramatically.
Wonderful.
Yes, and so I've heard, but I haven't yet to experience, that Samantha has the best hands on the coast. Because whilst you're under the LED, you get a massage as well.
Yeah, I did see her at work.
Yes.
So
at your
I'm
opening
looking for one on Monday.
I'm excited. I want to come over.
Yeah. And I also have a fantastic cosmetic nurse, Jessica. She's very experienced, and she's been doing full-time injecting for about 3 years now. So she's a registered nurse that I used to work with.
Okay.
So she's leading the way. She's going to be learning new treatments and high-end filler treatments. Yeah.
How exciting for the Central Coast. I just there are so many wonderful services up here on the Central Coast. Even cancer care, post-cancer care, even the women's health physios, pelvic health physios that are here on the coast, and then doctors who are delivering these services. I just think Central Coast women are extremely lucky.
Yeah, I think so. And I'm just really excited about getting the conversation started because, as we mentioned earlier, talking about our vaginas and sex is often taboo. I even know, like, with my mum, don't talk about that. I'm like, Mum, it's okay. You're going to have to get used to this.
Yeah, definitely. And it's not just younger women.
No, definitely.
It's the older women as well.
And I think that's who we particularly need to be helping have the conversations. It's our mothers who, they're experiencing a slight decline in their sexual pleasure and sexual enjoyment through their cancer treatment or through their menopause, and just to let them know that there are options out there if they want to try to enjoy their sexual life with their partner again.
Yeah, definitely. No one should miss out on intimacy, and intimacy just doesn't mean sex.
No.
But then sex is
it's part of it.
As an OT, we talk about activities of daily living, and sex is an activity of daily living.
Yep.
Yes, absolutely.
Yeah. And often if you address the sex, a lot of the confidence comes back as well. So it has a huge impact on your mental health, and obviously they're interlinked.
Yeah.
It's exciting to be able to offer that service. And especially for, our cancer patients on the coast. For the Petite Lady, we're offering at a significantly reduced price.
Yep.
Almost half price. If they come with a referral from anyone in their cancer team, doesn't have to be their doctor.
Okay.
It can be from you. It can be from their McGrath breast nurse. Anyone that's regarded as part of their treatment team, they'll get their treatments at a significantly reduced cost.
That is amazing. Yeah. That is awesome.
Something that's very close to my heart.
Yeah.
And,
wonderful.
I'd like to be able to give back.
So I will put that up on my socials, but on my website as well, because I have an area as well where I have recommendations, our recommendations, number of different services that are adjunct to all the services that they need. So that is awesome.
Great.
Do we have any questions coming up or any comments?
No, not at this stage. There's a few comments. Everyone's enjoying it. Just maybe let people know they can message us privately if
Yep.
they have some questions or anything that they want to know more about, and they can reach out.
Yep. So I've Kath, my assistant, is again behind the camera. She's monitoring everyone's comments. Thank you everybody for watching and commenting, and I hope you are all getting something out of this awesome conversation. And as usual, I could sit here and talk about this stuff all morning, but we've got work to do. We've got to go to work. So thank you, Dr. Kelly, Dr. Jody, for joining me on the Friday Live and getting this conversation out in the open and talking about your services that you have available at Coastal Goddess. And congratulations on opening.
Thank you very much.
Your
And
new
thank you so
clinic.
much for having us, because it's really nice to be able to collaborate with other services and also other amazing women on the Central Coast.
No.
So thank you very much.
My pleasure. And we'll have to talk about this again another time.
We will.
Wonderful. Thanks everybody. Bye for now.